I think sometimes, especially our generation, feels disenfranchised, that our voice isn't heard and that doesn't matter. But even as a young individual, like, your voice can be heard through voting and through contacting local representatives. And
affordable health care insurance has been a big thing. As an employer, the Affordable Care Act has allowed us to extremely lower our cost of insuring our employees.
And I'm not always as involved as I would like to be, and so this was a great way to get involved, a great way to get educated about healthcare and about what's going on in my local state and also how that affects the federal and the big picture.
Okay, I'll go ahead and introduce Sheldon Weisgrau. He's the director of the Health Reform Research Project, a foundation-supported initiative to provide education and technical assistance in the implementation of health reform and the Affordable Care Act in Kansas. Sheldon has more than 30 years of experience in health policy. He's worked effectively in the public, private, and nonprofit sectors to ensure the delivery of healthcare services in rural and underserved communities, and to enhance the knowledge and engagement in healthcare consumers, providers, and policymakers. Sheldon earned his undergrad degree from Cornell University and a master's degree in health policy and management from the Johns Hopkins University School of Public Health. Welcome, Sheldon.
Thank you. Before I get started, I'll join the rest of my panelists in thanking KMUW for putting this on. I think this is great how many people are here. Thank you all for coming. I also want to thank Kansas Grantmakers in Health, which is a consortium of 6 health foundations here in the state of Kansas that fund me, make it possible for me to be here. But also we're very lucky here in Kansas to have philanthropies that are interested in health and healthcare and are particularly interested in CanCare expansion, which is the issue I'm largely going to talk about. But before we get there, I wanted to give a 2-minute update on what's going on with the Affordable Care Act, which, if you listen to the political rhetoric, you may not have a clear idea of what's going on. So let me just state unequivocally that by nearly every measure, the Affordable Care Act is a stunning success. That, of course, is not to say it doesn't have issues and problems, and there are things that need to be improved and changed, but it has really done a great job in addressing the problems it set out to do. The primary point of the Affordable Care Act is to increase health insurance coverage. We have 17 million people in the United States today who have health insurance who did not have it in 2013 before the Affordable Care Act was implemented. That's not all it's about, though. When I talk about the ACA a lot, and one of the things I say is, there's a reason this law is nearly 1,000 pages long. It covers just about everything you can think of in our healthcare system. It also has a lot of provisions in addition to access to care and insurance coverage about quality and cost. We are making progress in improving the quality of our healthcare in this country, which really what I call the dirty little secret of healthcare is that the quality of care is abysmal. It is horrifyingly bad. Medical errors and people harmed by hospital care is the 3rd leading cause of death in the United States. But we are making improvements because what this law tries to do is make it easier for providers to offer better quality. It creates a different set of incentives for providers, and we're making progress. We have millions of fewer accidents and hospital incidents of harm than we had before the law. We have lots of people who are no longer having to be readmitted to hospitals after their discharge. So we're making progress. And in the bottom line, which is the cost of care, which is really what drives everything, despite all the rhetoric you hear about the increasing price of insurance, and we did see a big bump this year, the cost of health care is increasing at the slowest rate ever. We've been measuring these costs for 50 years. In the last 5 years, they are growing at the slowest rate ever. For the first time ever, healthcare costs are not growing faster than the rest of the economy, which means that the numbers Ed was talking about at 17% of the economy and trending towards 20%, well, right now it's holding steady at about 17, and that's never happened before. So I'll wrap up the kind of overview of the AC with that, but it's doing very, very well. So let me get to what I'm really here to talk about, which is Medicaid expansion. Medicaid in Kansas is called CanCare. So if I say CanCare, that's what I'm talking about. Let me talk about first what's at stake here. There's a lot of things at stake because the state of Kansas has not chosen to expand its program. And in a minute, I'll talk about what's going on and why we haven't done that. First, we're talking about health insurance coverage for about 150,000 people. So David earlier talked about the number of uninsured. There's actually about 300,000 uninsured in Kansas. 150,000 of them would be covered if we expanded the Medicaid program. We're talking about hundreds of millions of dollars that could flow into this state to pay providers for healthcare services. Many of these services are already being delivered now to people. Providers just aren't getting paid for them. And then we have a whole other group of people who never seek out their services because they can't pay for them. We're talking about 4,000 new jobs that would be created in the state of Kansas if we enhance this program. We're talking about a huge economic stimulus driven by hundreds of millions of dollars in federal money flowing into the state. There are no other programs I can think of where the state of Kansas is asked to make at first no investment and then later on a very small investment to bring back hundreds of millions of dollars. I can't think of any other circumstances where we turn that money down, but we have done it here.
That's right.
We're talking about returning federal tax money that we have already paid back to the state of Kansas. Every person in this room is a federal taxpayer. That money is going to Washington and is being sent to California and Colorado and New York and the 30 states that have expanded their Medicaid programs. They're not coming back here to Kansas. We're talking about the continued viability of a lot of our rural hospitals. We had a hospital close in Independence, Kansas, that Medicaid expansion may not have saved this hospital long term, but it would have certainly saved it for a while and given this community some more time. That one community was looking at $1.5 million a year in CanCare that was not coming to this hospital because the state has chosen not to expand its program. Independence is not the only hospital that was in trouble. We have dozens of rural hospitals that are right on the financial edge, and this is a huge issue for every one of them. We are talking about the number of people in our jails and prisons. The biggest mental health system in the state of Kansas is jail. We have a lot of people in our jails and prisons because they are mentally ill, they are uninsured, so they can't get care. They don't get access to medications. If they were covered by this program, fewer of them would end up entangling themselves in the criminal justice system. And finally, the bottom line, we are talking about life and death for some people. We know that having health insurance coverage saves lives. I wrote an op-ed a few years ago that I got a lot of flack for because I tried to put a number to the number of additional people in Kansas that will die every year because we haven't expanded this program. I was told you can't talk about death. It's not nice. Well, guess what? This is literally a life and death issue for several hundred people every single year. Okay. That's hopefully the ranting part of my presentation. Let me back up and talk a little bit about, people who know me know it doesn't take much to set me off. So let me first talk about CanCare expansion and what it is and give you some context. Why are we talking about this? Under the Affordable Care Act, there are two paths to insurance coverage. There are people who go to the healthcare.gov marketplace and buy private insurance policies. Most of them get some help to help pay their premium. About 80% of the people in Kansas who buy private plans through the marketplace are getting some level of subsidy to help them pay for it. The other path to insurance under this law is Medicaid expansion. Every state was intended to expand its Medicaid program to cover more people. The Supreme Court ruled that states are not required to do that. It's voluntary, it's an option. The state of Kansas has chosen not to move forward. 30 states plus the District of Columbia have chosen to do it. Tomorrow it'll be 31 because Louisiana's coming in. Their new governor was inaugurated yesterday, I think, and he's going to have Medicaid expansion tomorrow. Okay, so when we talk about this donut hole, what we're talking about are this group of people that can't buy private coverage because you have to be at a certain income level to get a subsidy to buy private coverage. When Congress wrote the law, they assumed that everybody below that level would be covered by Medicaid. Well, because Kansas has not expanded Medicaid, we have this gap between people who make too much to get on our current program and not enough to qualify for subsidies. And let me talk about our current program for a second, because it's very commonly misunderstood. Most people, if they even know what Medicaid or CanCare is, and let me say that this is a viewpoint that is shared by, I would guess, most of the people who sit in our legislature, believe that if you're low income, you're on Medicaid. Well, that is absolutely not the case. Medicaid is a program that's called a categorical program. You have to fit into a certain category, and you have to be low income to be on the program. So you have to be a parent and be at a certain income level. You have to be disabled and be at a certain income level. You have to be a pregnant woman and be at a certain income level. And the income requirements for each of those different categories are different. So it's an incredibly complex program. It's very difficult to wade through. Some might argue that's by design to try to encourage people to stay out. But wherever you fall in that, it's a categorical program. Being low income is not enough. So let me give you an example. In Kansas, we have some of the lowest eligibility thresholds in the country. Parents are eligible for CanCare in Kansas if household income is 33% of the federal poverty level or below. A mom with 2 kids must make less than $6,600 a year, $550 a month to be eligible for CanCare. Put that into even more real terms. A mom with 2 kids who works a minimum wage job half-time makes too much money to be eligible for our health care program for low-income people. If you're an able-bodied adult, if you don't have a disability determination, if you're an able-bodied adult and you're not a parent, you're not eligible for Medicaid at all. It doesn't matter if you don't have a job and haven't made a cent. You are not eligible. So when we have our politicians that talk about all these folks should do is go out and get a job, most of these 150,000 people are working. Those of you who know low-income people know that a lot of them are working more than one job. Having a job has nothing to do with having health insurance unless you have a good job and you're lucky enough to have an employer that offers insurance at a rate that you can afford. Okay, so under the Affordable Care Act, we have the opportunity to expand our Medicaid program to cover people up to 138% of the federal poverty level. So this single mom with 2 kids that I talked about before, who now must make less than $6,600 a year, that would go up to nearly $28,000. She could keep her minimum wage job and keep her health care. The other thing I want to add is that the way the program is designed now, it is actually a disincentive for people to work. If this woman is offered a minimum wage job half-time, she can't take it if she wants to keep her health care coverage. The expansion of CanCare would solve that problem. 150,000 people are estimated would enroll in the program if we expanded it. These are disproportionately racial and ethnic minorities because the uninsurance rate among blacks and Hispanics is higher than among the rest of the population. This is a large proportion of the folks that are treated in the safety net clinics you just heard about. Some of our safety net clinics in Kansas, 70 or 80% of their patients fall into this coverage gap. The whole world would change for these folks if we expanded CanCare. In fact, I've always considered it my job to put them out of business. And as I said, most of these folks are working, some in multiple jobs. The other interesting thing about this is that in our current Medicaid program, this is a program where the state pays some of the costs, the feds pay some of the costs. In Kansas, state pays 44% of the bill, and the federal government pays 56%. That formula is determined by, it's a complicated formula. It basically comes down to what the average income is in the state. It ranges from a 50-50 split in the wealthier states. So you go down to places like Mississippi and Louisiana, the federal government's paying 70% of the costs. Here in Kansas, like in a lot of things, we're right in the middle. Well, in the expansion, the cost sharing is much more favorable. The federal government pays every single penny through the end of this year. After that, the states have to kick in a share. It starts at 5% in 2017. Eventually in 2020, it's 10%, and that's where it stays. So this is a program where the state would pay 10% of the healthcare costs, the federal government would pay 90%. As I said earlier, I can't think of any other program where the federal government says, give us $1 and we'll give you 9 in return, where we say no thank you. By shifting these costs to the federal government, we are looking at making this expansion budget neutral. There have been analyses that have said that this pays for itself and maybe actually brings more money into Kansas. How does that happen? Well, we pay for services for the uninsured in a lot of different parts of our state budget. It's not only in the Medicaid line item. If we're now covering more people under CanCare, we can phase back some of these other expenditures we're making in our state general funds. And rather than the state of Kansas picking up all those costs, the federal government's going to pick up at least 90%. Again, that's your federal taxpayer money that you're already paying. So this is something that when you hear legislators talk about, they're worried about the long-term cost. It's an absolutely legitimate worry, but there's plenty of data out there that should alleviate that worry if they choose to pay attention to it. As I said, 30 states and a district have expanded. It'll be 31 tomorrow. Many of these are very conservative states with very conservative governors, just as red as the state of Kansas is. If they can do it, certainly we can. There are active discussions going on in 4 or 5 other states, places like Wyoming, South Dakota. I think they would give you a run for your money if you wanted to argue that we're more conservative in Kansas than they are. Utah, even the state of Alabama is talking about this. The governor of Alabama is a physician, very much opposed to expansion. He appointed a blue ribbon panel in his state to come up with ideas for expanding healthcare services. He was pretty confident that in Alabama they would come up with a lot of other things other than Medicaid expansion. They didn't. It's a #1 recommendation on their list, so now even Alabama is considering this. So what's going on? Why aren't we doing this? Well, capital P politics. That's what's going on here in Kansas. The biggest weight around the neck of CanCare expansion is that it's part of Obamacare. Now, legislators that are opposed to this won't ever say that. I shouldn't say they won't ever say it. Some of them will say that. Largely, they come up with other things. And so one of the things you'll hear is they don't trust the federal government to keep their promise to pay 90% of the costs. My response to that is always, this is not a promise. This is a federal law. There's not some bureaucrat sitting in a room in Washington who's going to decide every year whether to send a check to the state of Kansas. Federal statute says the federal government will pay this money, and until that is changed, the federal government will pay the money. That's how it works. It's not an option. And we know how likely it is for Congress to pass any law, much less a change like this that would literally remove health care from millions of people. Not an easy thing to do. You hear that we can't afford it. I think I already talked about that. There is good, credible data that for at least the first 5 years, and likely for years after that, this will pay for itself. Even if you don't believe that, you can certainly have a discussion about whether this is a worthwhile use of your taxpayer money. There's an argument that we shouldn't be covering able-bodied people. I thought that was addressed great. We heard earlier about some of the forums we've had on CanCare expansion. We've heard about folks from Indiana. The president of the Indiana Hospital Association said, when has able-bodied become a pejorative? We should be taking care of our disabled people. and we should be providing health care for our low-income people. And let me just add that we also heard tonight about the shame that's associated with some people with being on Medicaid. Well, you know what? Everybody in this room that raised their hand that has health insurance is getting a federal subsidy to have that. That money is given to you as a free benefit without being taxed as income. It is the #1 federal tax giveaway in this country. Every one of us with private insurance probably gets more benefits than somebody on Medicaid does. We don't feel shame about admitting that we're on private insurance. We shouldn't make people on Medicaid feel shame for having that insurance. Legislative leadership is afraid to have a debate about this. You've probably heard earlier this year we had 3 key legislators on the Health and Human Services Committee who have expressed support for expansion. They were removed from the committee. The further problem with that is that they were the 3 legislators who knew the most about health and health care on this committee. So not only does removing them damage our ability to get CanCare expanded, it damages our ability to have any intelligent health legislation go through that committee this year. Now, people always ask me, well, what can I do? You guys here in Wichita are in a very good position because the chairman of the Health and Human Services Committee, Dan Hawkins, is a representative from Wichita. He is a barrier to this.
Yes, he is.
Last year, he did hold a hearing on this in front of his committee, which was the most amazing hearing I've ever seen in terms of the number of people that showed up. They were pouring out of the State House because we could not fit them in the hearing room. Representative Hawkins did not let his committee vote on the bill because the bill would have passed. House leadership did not let the House vote on the bill because it might have passed. You also have Susan Wagle here, who's the president of the Senate. She has not said a whole lot about Medicaid expansion, but if she came out for it, it would be a huge act of leadership and it would be a huge thing in moving us forward to get this done. So you have to be engaged as a voter. One of the things about CanCare expansion is it's probably not an issue that drives people to the polls. It's probably not an issue that makes people vote for one official over another who's running for office. We have to get it to that point. We have to get legislators who are against this to feel the heat from their local districts, to feel that they may not be reelected because of this issue. And if we can get there, then we'll get CanCare expansion. The 2016 election is going to be huge. We're going to work on this during this legislative session. We're probably not going to get it done this year. It's going to come over into next year. And next year we'll have a new legislature with a new election, and hopefully it'll be more amenable to this. But ultimately the way to get this done is not with the wonky numbers and the policy facts that guys like me bring to the table. It's by putting pressure on legislators in their local district. That's how this stuff gets done. It has to be a grassroots effort. But this is the most important healthcare issue we have in this state. I am confident we're going to get this done because it's too good of a deal for the state to pass up. You don't have states like Wyoming talking about signing on to Obamacare if there wasn't something in it for them. We have to get our legislators past the politics and get them thinking about their constituents, and we'll get this done. Thanks.